newcomer, but I think we'll be doing a great job. Timing is everything. So I totally have anything else to say. Okay, the next theme also comes from the Community Health Center. Their title is Integrated Services Kingston and Area Transcultural Mental Health Consultation Service. The mentor is Joanne Brady, and the community partner is Rasha Fahim.
Some of us were lucky enough when coming to Canada, they had financial support, family support, they had destination and goal, and somewhere to settle or somewhere to live. The newcomers we're talking about came to Canada with absolutely no clue. They had no option other than coming to Canada. They had no destination, they had no goal. The KCHC-ISKA, the Immigrant Services, noticed that while settling them down in Kingston, there is a major issue behind finding a house for them. It's mental issue. It's rising so fast among all immigrants who were forced to come to Canada for war zones, running from political situations, and stuff like that. After 1 year from governmental and community support to those newcomers, the funding runs out, and they were left alone with all their trauma from the trauma experiences they've been through, or the new trauma they are encountering, such as poverty, isolation. They need to adapt to Northwestern culture, other than racism and social problems. KCHC-ISKA noticed this problem, and they were so overloaded with settlement services to those newcomers. They had no resources, no ideas how to address this problem. They reached to the PhD-CI community for people like us with expertise of research and problem solving to find a solution to this mental health issue. Currently, there are 550 newcomers in Kingston facing this problem. The biggest problem also is that mental health service providers are so disjointed. Some of them have good services, some of them have no services at all, but they don't talk to each other. We did few interviews among them, and we found common themes and problems between them.
So our team took a twofold approach into tackling the issue of mental health among newcomers. We got a tip from Rasha Fahim to look into a pilot program that was happening in London, Ontario, that was trying to address this very issue of newcomer mental health. We took a deep dive into this pilot project in London, having a conversation with one of the founders of the program, as well as a counselor who works in the clinic. We also looked into a peer-reviewed academic journal article that this group had put out around the different community organizations that were trying to address this need, coming together and talking about their common challenges. We looked into a couple of the program forums as well. We also, in addition to getting a detailed review of the London Transcultural Mental Health Program, we wanted to get a survey of what was available to newcomers in Kingston. We had 20 interviews with different service providers as well as cultural supports for newcomers to get a lay of the land of the mental health climate in Kingston.
This is a brief description of the problems, the common problems and themes we found. However, we prepared about 20 pages report for Russia for details about these problems, but I'll just go over them quickly. The biggest problem, of course, is stigma. The newcomers from cultural backgrounds, they think mental illness is a big shame. So approaching mental health services was not there for stigmatic reasons. There's also a shortage staff. The newcomers are coming in big numbers every week. So the settlement workers or the mental health providers have only a limited number of staff. They need funding to expand their services. So funding is another big issue. We also have the disjointed services. Other problems that list problematic are languages. So most mental health providers don't speak 3 or 4 or 5 languages. So the newcomers coming from Africa, from the Middle East, from East Asia, and we don't have a supportive linguistic. Religion was a problem at the beginning because some people think that their mental health problems are because they're abandoning God or not worshiping God enough. So we approached the Islamic Society of Kingston to ask if there were any religious people approaching them, and there were actually. And thankfully and fortunately, the Islamic Society of Kingston staff were educated, so they are directing them to mental health service providers. So, and also religion could be used as an approach to access those newcomers' mentality and tell them that it's okay to seek mental health services or help.
Based on our conversations with our friends in London to understand the transcultural mental health model of newcomers, and also our deep dive into figuring out who is accessing and who is talking to newcomers, helping them overcome mental health challenges, we put together a framework of recommendations for Kingston, but especially for the Kingston Community Health Center Immigrant Services, that puts newcomer mental health at the center of making Kingston at its best, and putting immigrant services at the helm of working towards a wraparound service model that newcomers have accessible mental health for their needs. Some of the pieces that we are hoping to incorporate into a model of better mental health services for newcomers include creating a circle of trust amongst the services at Kingston Health Center, but also abroad in the community, putting immigrant services in control of helping our mental health services around Kingston to provide the cultural components needed to provide meaningful mental health. We know that this is a possible aim, and we are hopeful and optimistic and confident that newcomers in Kingston can have accessible mental health services with you and with our community partners. And so for that, we thank you so much for your attention and look forward to any of your questions.
So with the microphone next way around, I think one of the key thing that you hit on was the fragmentation of services. Were you able to speak with enough of them? Is there a willingness to communicate and collaborate in a way that would improve overall service delivery?
We've brought our experts here to answer the questions.
When we talked to, I think we interviewed 20 people in 16 interviews across the city of Kingston, and that did give us an overview. We didn't see everyone, obviously, because there are so many different groups here who are providing great services. One of our suggestions in our report to Rasha is appointing a point person at KCHC to collaborate and keep up to date with what everyone is offering and to be able to provide a sort of referral system so that newcomers can go to whatever service in the city suits them best. So a multi-center for people who are young. There's also addiction to mental health, which can provide a variety of services, and especially at low-cost rates. So that point person would be instructed to kind of start that circle of trust and be at the center.
Hi, my question actually continues from your question itself. That it's very clear from your presentation that there's a huge demand for it and requirement for it, but has your research surfaced on is there enough supply for mental health providers in Kingston? For the numbers that we are seeing, I think 550 newcomers in plus, and it's an exponential number, so I'm sure it's going to increase. So does Kingston have enough resources for that city?
Hi. Thank you for your question. What we think is, at the moment, Kingston does have enough resources. It just is not allocated in a logistic proper way at the moment.
And one of our other issues that we encountered is because of the stigma, people aren't coming forward to use the services. So what we want is to kind of, as Ftoon and Matt talked about, try to attack that stigma and bring it down so that people can feel comfortable coming forward and accessing those services when they need them, rather than feeling overwhelmed at the time that it's happening.
Thank you. I'm really glad you addressed that because it's rarely talked about mental health issues. So my question is kind of related to what she has just asked. My understanding is that even for Kingstonians or Canadians, whatever you want to call them, the wait list sometimes to get to see a counselor is important, and the availability of counselors at different centers from Kingston Health Sciences, Kingston Health, I think it's called Kingston Health Community Center or Monty Center, sometimes is quite long. And we do know that mental health issues to address them properly is a long-term treatment. It doesn't happen with just one visit, and that is exponentially, in the same way. So, do you think the resources are going to be there? Not only the funding, but the people, the number of people, and how do you think that can be addressed properly? Thank you.
I have a thought. Okay. So I think we don't fully know the bandwidth or the horsepower of our mental health resources. There's a lot of we had a lot in talking with our community partners. We heard a lot of, I don't think those people know what we're doing. I don't think these people know, this organization knows what we're doing. It'd be beneficial if they knew, So yes, there are wait lists. But there are also a lot of services that are kind of at the buffet of mental health that aren't being fully tapped into. And we don't know the full potential without a very integrated model where community organizations are coming together to offer their services in a kind of seamless path. So we don't know what that looks like yet because it's very chunky and island hopping at the moment. So once that mental health interstate gets built, then it's like, okay, now we know kind of what human resources we have available, and we know the human resources that we need. The short answer is yes, there definitely needs to be more human resources dumped into the mental health services of Kingston. That's the short answer. But we also don't know what we're capable of yet because we're so disjointed. Yes, thank you.
Thanks very much. Thank you. Message in that final series of questions, because I think everybody was zeroing in on a similar issue, and the answer goes to a problem that's evolved with